Good afternoon and good evening. Welcome to the Black Ops Management Solutions and CareStack webinar, Disrupt Dental Management. We're going to wait about another minute and a half or so as people get logged in. This is Jim Gerson from CareStack. And don't worry, your camera's intentionally on mute and so is your microphone. So don't worry about it if you're just casually hanging out and joining tonight. So Lynn and team, we'll probably wait about another minute or so and then we'll get started. I want to encourage everyone that's here early to use the Q&A feature for questions as they come along during the course of events tonight. We'll do our best to answer your questions during the actual segment of the contributor. So if you're using a PC, you'll find the panel in Zoom at the bottom of your screen. If you're using an iOS device, the Q&A feature will be in the top of the panel. And just a reminder, you are intentionally placed in mute. Now, I'm going to talk to you about it in a quick advanced move. If you want to ask a question, raise your hand and unmute yourself so you can ask a question of our panel. You can do that inside the Q&A feature. You can choose raise your hands. Then what happens is I would unmute you as a moderator or facilitator, but then you're going to have to unmute yourself. So this is like a Jedi trick here. So you've got to be really committed if you want to ask a question verbally, but go ahead, please type away at any point if you have a question. So Lynn, I'm going to turn it over to you to get started here. I think we've waited, it's about a minute after the hour, and I don't want to penalize those people that are here on time. So I'm going to turn it over to Lynn Campbell, our host for this evening.
Perfect. Thank you, Jim. I've got to definitely share an item here. So I've got to get my desktop up and running for you guys. We've had a little bit of a challenge getting my desktop up, but give me 1 second and I'll get that for us all. You're going to see I'm actually having to hit Zoom as well. So let's get us set up here.
Yeah, so we can see your screen, which is good. You just got to toggle over to a different tab and we're good.
Yeah, I need to grab my presentation and you guys are in it. So let me see how I can do that. Let me minimize. Well, this is not going to be good. Jim, you're
Lynn, yeah, Lynn, if you prefer, I can grab your presentation if you like.
If you would like, it's actually right behind your picture. So it's on my desktop right behind. So if I can get it.
Yeah, I can't see that from here. So that's
Yep.
I don't have that ability to go in there. But if you want to narrate, I'll pull it up. I think you've emailed it to me before. So let me go in and grab it. If you just want to start, with and I'll present your.
Yeah, let me get started, guys, and apologize for this. For my reason, I'm having difficulties. We were doing good. But anyway, on behalf of Black Ops Management Solutions and CareStack, we are pleased to welcome you this evening. And thank you guys for taking the time and the patience with us this evening. We share CareStack, Black Ops, and the team you're seeing tonight, we share a passion for providing the dental community with innovative solutions for managing dental practices and the emerging DSOs. The synergies Black Ops Management Solutions and CareStack holds will allow us to provide you with a multitude of high-quality, value-added services. Helping you establish useful connections is not our only goal. And with that, how perfectly that is. And so we will actually share that, Jim, so we can kind of get started here. So attending this webinar this evening, our goal is to provide you with insight into pivoting away from the traditional business focuses that we've had pre-COVID, if you would. Our overreaching pearl from this webinar this evening is that we will have we've all had to embrace new standard operating procedures. In our practices as of late, the clinical changes have been applied across the dental industry, but it's important to understand those changes by themselves will not position our practice to thrive during the pandemic, or our success depends on a pivot away from that traditional pre-COVID business focus. Dentists who do this will emerge on the other side of the economic crisis stronger than they entered. So this evening, as Jim made mention, I'm Lynn Campbell. I am the president and CEO of Black Ops Management Solutions. And unlike traditional consultants out there, we're veteran industry operating executives working in the field, working in the operational space, rolling up the sleeves and getting things done. We work collaboratively with management teams to build sustainable processes and teams that improve the underperforming supply chains and manufacturing operations. Our clients experience significant improvements in operating efficiencies and bottom line performance as a result of our guidance and contribution. And many of you are on this call this evening, so thank you very much for joining. So as we get started, and we're going to be looking at addressing the new standard operating procedures, and that's what you'll find this evening. All will be sharing that same information. Standard operating procedures, you know, you've heard this also known as SOPs. And Jim, if you want to take it to that next slide. Thank you, sir.
Got it.
So the SOPs, you know, they're an integral part to the success of any organization. You know, they become even more critical during the present coronavirus pandemic. You all have seen so many changes out there. So we need to put into place clear SOPs that provide guidelines for the dental teams on how to safely treat our patients. COVID-19 specific SOPs are there, will ensure safe and consistent treatment for every patient that comes into our office. Also, COVID-19 specific SOPs will minimize liability to the practice by providing evidence that consistent and accepted procedures were used for all patients. You know, all office follow universal precautions. We do that. That is just what we do, right? But because of the high rate of infection with COVID-19, that's not enough. So what we do is we find that we need to build very standard operating procedures. We can leverage some great tools such as the American Dental Association. We can access their website. They have interim guidance for us. There are many online SOPs, or if you get stuck and you just need some help, you can always reach out to Black Ops, and we're more than happy to help you with your SOPs as well. But you got to keep in mind 6 simple things. We can really get complicated when it comes to standard operating procedures, operating manuals, you know, those books that we like to put in the cabinets and hide on the desk. But let's keep this in mind. Simple 6 steps. Why do we need a policy or a procedure? When was it created? Kind of need to know the date. What does it cover? Who is it directed to? How is it done? The playbooks that we need to execute on, right? And how is it evaluated? Those are all important steps in building an SOP. So as we move forward and we look at the business world, we'll see the proper operational setup leads to long-term financial success. This is particularly true in a service-based industry such as, you know, the emerging DSOs. The challenge is that the industry is still new. Performance indicators continue to evolve. Processes are improvised and experimental, and talented leadership to design and implement comprehensive operational plans is often scarce. So inexperienced and underdeveloped, especially at the larger scales. You know, tonight we'll explore a basic outline to design and implement a basic operational setup that will support financial success and the company's growth. So first and foremost, let's look at what we need to look at here. You know, one must understand that operations and clinical go hand in hand. We think that that's pretty normal. That goes on in all of our practice. But while it's stated that many emerging DSOs, it really isn't being practiced. They feel it is, but when you look inside, we find the danger is that operations and clinical become siloed. You know, and this happens because too many leaders have a stay in your lane mentality. So the problem is compound since most operations people don't understand the clinical and vice versa, the clinical not truly understanding the purpose of the operations or the ultimate goals. So this creates a us versus them mentality that tends to be disruptive and destructive in the long run. You know, clinical needs to understand the goals and the objectives of the operations and to buy into it. The key to a successful operation setup is the integration of the clinical and operational team and at all levels. It's what, you know, I call the clinical operational bridge. This is the space where the operational and the clinical teams share their goals and objectives and design and implement processes that promote and support performance success. You know, at the office level, the office manager, the dentist, the hygienist, they all must align and work together on clear goals and objectives.
Hey, Lynn, not to interrupt here, but we do have a question for the audience. Are you okay if I bring that up now? And
absolutely. Sure, absolutely.
And please, I think it's appropriate to redact names, but someone's looking for a real life example of like the archetype of like a situation that you've seen firsthand where the clinical and the operations team have worked symbiotically And, you know, what were the traits of that? How that come to be? Just if you could kind of give the anatomy of that, I guess.
Yeah, and I'll bring it to true reality right now with COVID, social distancing, and how do we really manage that in our practices today? So this is very much where operations, you're working from, if it's a centralized service, and keep in mind, we're thinking of the emerging DSO that may have some centralized servicing. So if you would, their schedulers are centralized in a location separate from and away from the dental office, allowing more social distancing to be provided if you would, in the dental office or in the practice. So because of that, the schedulers need to understand exactly the maximum capacity that can be scheduled at any given time and why. And also the schedulers need to prepare the patient that's coming in. If it's a patient coming by themselves, what they should anticipate. If it's a patient bringing someone else, then that someone else may need to sit in the car because we may not have room in the lobby. And also what to prepare when you're getting there. So now take that back to the front desk. Let's think of the patient coordinator or the office manager. When that patient does arrive, it's the check-in, which is different than they've ever checked in before, right? We're having to take their temperature. We're doing the questionnaire. If that wasn't done remotely, that's done inside. And so that is all happening before they even move past, if you would, into the operatory area. So that's where that connection has to happen with the centralized services. Now we're moving that patient through the process of potentially the x-rays into the operatory to be taken care of. So I've got to now work with my dental assistant. I need to work with my hygienist or the operator. And it's where seamlessly how that patient feels just a natural flow, but all of those pieces and elements need to be put into place. Again, back in an SOP, what are we doing? Why are we doing this? Because of COVID-19, this is what we need to achieve. This is how we're going to do it, map that down in the playbook, and even role play that so each one has. You can just imagine if the scheduler is just scheduling all day long and we end up with so many, it's great to have the revenue in the top line, but if we don't manage this, then from a social distancing, we might be crowded, it's running late, things of that nature. I hope that answered that question for you.
Yeah, thank you for speaking to that. Sorry to take you off track. And again, I want to encourage, this is great stuff. We don't want it to be 5 talking heads up here, right? For the next hour or so. If you have questions, use the Q&A field, please. So thank you, Lynn. I'm going to advance your slide here, if that's all right.
Oh, yes, let's move on. Second step, perfect. Here we go. So, second key to success is consistent training. Just kind of shared that in an example. We've got to follow up, evaluation of the operational team. We have to have formal training, follow-up training, on-the-spot training. We must establish and implement it and evaluate on an ongoing basis, both at the practice level and at the group level. We can't just dictate, you need to do this at the practice. We all need to understand those bits and pieces. And then once again, your standard operating procedures must be created, but not just created and put in a binder or on paper or in some shared file, but then really how do I execute? If you would, we call it the playbook. How do I play? What do I need to do in action to execute the SOP? So as you can see, SOPs are the most effective way of identifying, summarizing, and promoting the implementation of best practices and clinical excellence across the entire organization. So let's move to, the power of communication. As May mentioned, it's one thing to just have some nice systems in place, processes in place, and have a playbook, but then you got to communicate. So communication brings us to the third key to operational success. And frankly, this is an area where the majority of the emerging DSOs fail miserably. And when I say emerging DSOs, they can be groups, but it's multi-site. It's when there's a lot more people, there's more than 10, more than one office, is to ensure that the message is clear, right? So sharing the big picture is a must and should include the visions, the goals, and the performance targets. Let's not forget about those targets because we do have to achieve. Many managers believe that they're doing a decent job of communicating these ideas across the organization, but once you really get into the practice, and this is what Black Ops finds every time, is when we walk into the practice and we start assessing what really is being delivered or received by the team in the practice, the reality is quite different. So simple ways to achieve this is through company newsletters and site visits and relationship building and Zoom meetings as of late. So it really is at this moment in time over communicating and setting very clear expectations. So that does take us to just an overview, if you would. Establishing a record of operational success requires support and commitment. You know, it also requires planning and a systematic implementation, as well as consistent follow-up. It requires a marriage, if you would, between operations and clinical teams, continuous training and feedback, and honest and clear communication based on well-defined objectives and achievable milestones. Again, let's not forget the goals that we have in place. So again, as we summarize standard operating procedures as of late, we have systems in place, we have processes in place, and pre-COVID, we were running pretty standard on the way that we do business. But I'm confident to say that COVID has caused us to really stop, revisit, or analyze our business. And now we're looking at, what do I need to be communicating, need to be setting as my standard of operating procedures? Am I exhibiting the right plays to get the results? Can I get those same results on less patients? Can I get the same results on less revenue? And really, we want the same, if not more revenue, but just on less patients. So there's more than just writing an SOP. So let's now learn how to pivot a little bit more. I'd like to introduce Dentistry on Purpose, and Patrick and Shannon will share with us some of their expertise in helping us pivot in this industry today.
Hey, Lynn, you're too quick at the trigger, my man. We got one more question here, okay?
Sure, absolutely.
I like it. So someone's asking that they represent a multi-location group, and a challenge that you and I have heard a lot about it, I'm sure, same with Shannon and Patrick and Jordan. They, reopening, lots of new staff members. They see the value in the SOP because it helps them get these new staff members up to speed quickly. But what are some pitfalls they're asking that they can avoid in implementing SOPs with new staff, or maybe tricks or tips that you can relay to them?
I really appreciate that question, because really today, onboarding post-COVID, and I'm calling it post-COVID, we're still in COVID, and I get that. But because we have so much more of an infection control standard that needs to be trained, we're used to pre-COVID infection control, some of that training that just happened. Basically, I'd go sit in front of the computer, right, and go through the steps because I had a system that walked me through that. Today, we don't have those tools necessarily, so we need to ensure that day one is onboarding the new team members with all of the typical HR, but we also have to go over new HR rules and regulations. And I know Jordan's going to share with us because that has enhanced and changed in this pandemic that we're in. Then once we leave the fact of looking at day one and bringing them on board, we really need to spend the time on the infection control. So that's really another day. And the associate team member has not even really touched the floor. They're not engaged with patients. They're not engaged in the operatory. We need to give them that time. Here's what I absolutely do see. We hire them this morning. They actually are answering the phone or they're working chairside this afternoon. As soon as they sign the paperwork and said, here's my I-9, here's my driver's or social, they're immediately going to work. And we never bring them back to training. So again, you do an injustice for yourself if you're not allowing yourself to schedule that time. It's an investment at the front end that will protect you at the back end.
Yeah, thank you for speaking to that. Sorry to interrupt. I brought your final slide, and let's go back to where you were making the introduction to our next speakers.
And absolutely, and guys, you can get in touch with me, like you said, Lynn at Black Ops Management Solutions. But as I may mention, let's turn over to Dentistry on Purpose, and I'm going to turn over to both Patrick and to Shannon, and they have some nice tricks to help us generate some revenue. That's important as well.
Absolutely.
Thanks, Lynn. I appreciate the introduction.
Absolutely.
Go ahead, Patrick.
Lynn, thank you so much for having us, you and Jim, and appreciate the time to come and just talk about some of the fun stuff that we love to see. I'm here with Shannon. Shannon is my VP of Sales. He is also a really good friend of mine for the last probably 8 or 9 years. Man, I really trust. So we just want to go through and just talk about what we see as in dentistry. My background is one where I've spent about the last 10 years in dentistry. I've worked with Lynn. I know firsthand about his character and about his ability. And so I'll actually, I don't mind vouching for the guy. I think he's not just that, he's a real good friend too. So again, we appreciate the time to come here and do this. I've spent about 5 years, my first 5 years in dentistry within a DSO. We were multi-site, multi-state, about 45 total offices. And so we really had a good time. It was a good learning experience, but I saw a lot of pitfalls, a lot of opportunities in that area. And so when I left there, I started this company, Dentistry on Purpose. The whole idea, the whole focus of this was really to sit back and to identify how we can help dental practices be more successful, more purposeful, and more intentional about what they do. So our goal is always to provide practical solutions that just give you more capacity to do more with your staff, so you can deliver better patient care, better patient experience. So with that being said, we'll just go down. What we've identified in this process are just some standard challenges that happen within all parts of dentistry: workloads, risk. Kids are at home now, so you can't work. You have to work remotely. The new SOPs that Lynn was talking about, insurance verifications. You're doing more work with less people. And there's challenges all the way around that. And so have a little funny picture up here. This is actually this is an actual pano with 147 teeth that have grown out or are in it. So it was quite a feat for the dentist who the operational challenges of just taking care of them and treating them the way they needed to be. But the biggest impact on this is your time and resources. Everybody is going to be pushed to the max. They're going to be overworked. They're going to be doing new things. So things get to be a challenge in what we're doing. And so we wanted to just take that. And our goal is to always show you a tool or a resource that can actually help you save time and actually be able to do more with less. So,
and I think today too, with all of the challenges you just saw on the previous slide of the new introduction of COVID related or pandemic related new challenges every clinic is facing, you know, time is the real critical key element. You know, today we're focusing on really the gathering of insurance payments or insurance information, the posting of payments, and the tracking of insurance credentials. And we're going to get into how we can help offload some of that work to save you a tremendous amount of time. But if you look at some of these statistics, you know, gathering insurance information, 15 hours a week of hold time or chasing down data for an average size clinic, you know, there's a great deal of time spent not only getting insurance information, but also interpreting it, making sure that the patients who are coming in tomorrow from that interpreted data are actually covered by that insurance. And then when that data is interpreted, it's difficult to properly communicate that a lot of times internally within the organization, especially these days. And not to mention the challenges around getting into the insurance portals to get the information in the first place. In posting of payments, we're going to center in on the login process, specifically around enabling your organization to very quickly download information from an insurance organization related to remittance advices, EOBs, that type of information. But that process in and of itself is also quite time consuming. And lastly, we're going to zero in on tracking insurance credentials. This is a migraine headache for every single client that we speak with and every organization we talk to. Keeping up with lost or forgotten IDs, lost or violated passwords where there's not, they've forgotten the password, where you have multiple clinics and there are multiple people trying to access multiple insurance companies. And it's very, very difficult to keep track of that. And most organizations are trying to do that with spreadsheets or Post-it notes, even worse, which obviously is not a very secure process in any way. And obviously a very a big concern for a lot of organizations around HIPAA and privacy and security and making sure that data is protected. And what we're going to focus on today is showing you 4 solutions. Insurance verification, we have a solution, JarvisAV, which is designed specifically to enhance that process where you're actually trying to verify insurance and do so in a way that gives you more than just the check the box eligibility. We're going to also focus on a remit download solution called IRAD, which automates the process of downloading the remittance and making it very easy to access. A very simplistic approach, but a big time saver. And then we're going to zero in again on insurance password management with our iCred and our iClick solutions. Lastly, we're going to touch on roster management. This is for states that the solution is beyond rosters, but this is for managing Medicaid or managed care insurance companies, where I think some of those states include Texas, Louisiana, and Georgia. But those organizations where there are rosters in place that require organizations to maintain a certain level of patients. And we really focus in on automating those processes that are consuming a lot of your time and making it very simple to do it. JarvisAV is this is our automated insurance verification solution, and we automate the process of actually going out and pulling down information from an insurance portal. So this is a client-hosted solution. We verify insurance twice. We don't just do it once. We go out 5 days prior to an appointment, so you have a very rich, proactive view into the patients who are coming into your organization to be sure that they're covered, that they haven't had these procedures you have them scheduled for done somewhere else, that type of thing. And then we also do it the day of, so you actually see a day of appointment verification. So if there are any issues, you can jump on those right away and get them resolved. And we can also integrate this information back into your practice management system. The information that we capture centers around treatment history, which is very unique. A lot of the eligibility solutions out in the market don't do that. We do provide that information. We also do the eligibility status, and we also do a benefit accumulators. In downloading that treatment history, as you can see on the right with limitations and opportunities, this is really where we're pulling down information around dates of service for pro fees, FMX, Pano, sealants, those types of things, but we're actually doing the mental gymnastics to show you if this patient is coming in for a pro fee, we verify with the insurance company, not just your practice management system, that this patient is actually covered for that procedure, that this patient did not have it done 3 months earlier at a different physician or a different dentist. So, making sure that that patient's coming in for a procedure that is actually covered. You don't want surprise, payments or things like that to come up. We also show benefits remaining, deductibles remaining, co-pays that are due, those types of things. And we literally download dozens of more fields of information that can be utilized in this. One thing I want to stress and emphasize throughout this process, what we're about to show you is very customizable. And the way we say it is, if you've done one DSO or one dental clinic, you've done one. It's not a one size fits all by any stretch. Patrick, you want to move?
Yeah, absolutely.
Just from what we provide from JarvisAV are two types of reports: exception reports and detailed summary reports. So we're going to start with exception reports here. These are on the left-hand side, reports delivered. These are the reports that and we'll show you some examples of these momentarily, but these are reports that we deliver that gives you a very easy to view status of the patients that are coming in. We show patients that are not eligible, where there's insurance that has not been found on that patient. In other words, they may have changed insurance, or you have the wrong insurance on file. Appointment not verified, where there may be a pro fee issue, where they may have had it done before, or more importantly, it may just simply not be time for it to be done, or it's not covered. Other frequency limitations, we do insurance different than assigned. So if there are conflicts with the insurance on file, we show that, and we also show when there's no benefits remaining. The benefits of this are great because you're able to actually see all of your problem patients first. So your staff is able to work from an actionable list of patients where they can see immediately who is having an issue, and they can address that versus having to go through a whole appointment book for the day and try to determine who actually has a problem. This is a report that's run, a process and reports that are run every single day. And it's, like I said, it's totally customizable. In terms of the summary detail reports, we also provide today's appointments. So we summarize those exception reports we just talked about into a very easy to read detail report, where we also highlight those exceptions for you. So it's very plain and easy to see. We'll show you that in a moment. But again, you're able to work those problem insurances first off of that report. You have an actionable call list from that report also. So if you have patients that may be due for a prophy that aren't scheduled, you can see that as well. And we also do future appointments. So this is 5 days out, and that's configurable, by the way. So we can show each morning which patients are coming in that increment out, 5 days out, and show you any problems with those patients. So you're able to proactively reach out to those patients if there's insurance has changed or they no longer have insurance. That's a seat now that you can fill with a patient who is covered or who can come in and be treated. So you keep your chairs full. We also allow you to work those problem insurances first. Overall, folks, this is saving you a ton of time, and this allows you to really spend more time on your patients and improving that patient experience, especially with all the COVID-related regulations and things like that. And I'm going to turn this over to Patrick to kind of walk through some of these example reports and let him explain these and show them to you.
Well, fantastic. Thanks, Shannon.
Jim, do we have any questions? I see you're on mute. I think you may be talking.
Yeah, I'm sorry. We don't have any just yet, but someone did mention that the microphone for Patrick sounds a little bit far away. I don't know if you're able, Patrick, to get a little closer to the mic. Would that have any ease?
I can try that.
Okay, thanks.
Yes. Okay, let's try that. So I want to go back just a second to what Lynn said. His third note, third key was really about communication. So we believe in the over communication and oversimplification of whatever we're doing. So the idea behind these reports are simply one thing, and that is we want to make sure that there's no doubt what people know about their patients that are coming in. We always say that it's not the 100 patients that you have scheduled that you're worried about. It's only the 3 or 4 that don't have insurance coverage that's not going to have their coverage, their treatments covered. So we try to make it real easy. Why look through a whole laundry list of appointment books just to find the 3 or 4 that you need to really deal with right now? So we make it real easy. Within a daily report that comes out, there are exception reports, and then there's our detail reports. So the exception reports come back through this process of looking at things like the patients that's not eligible. Those are coming in for prophy that aren't eligible because their prophy date is past that time. They're not quite in their frequency just yet. Or, maybe we look for them and we didn't find them with the insurance that was currently in place. These are actual reports that are out of our some of our groups that have allowed us to use this information. We just changed the PHI on it, and these are reports that actually came out today. And there's several different clients in here that allow us to see that these are all customized. They're all configurable to however you need them to be. So even the ones that we haven't verified, maybe they want to know that. Maybe there could be an issue with the password. Could be that there are issues with that insurance. That insurance is one that does not have a portal from which to verify insurance, that it requires a call. Various things like that could be in here. Patients found eligible, but may need a main dental home change. This might go for if you have assigned patients to you and they're not assigned to you, those that are coming in. It just lets you know a little bit ahead of time. This may not be for your state, but it's definitely something to just show that we have the flexibility to kind of customize to your state, to your insurance on what the needs are. This is another one within Texas. They're not allowed to have more than 10 first dental home visits. We want to acknowledge that. We want to identify and let them know if they come in, they're not going to be covered. So that kind of exists for the exception reports. You have not eligible reports in there. If there's a need that your office needs to have clarification on, we've got that. And then we have the detail reports. The detail reports give you everything for a day, as well as the future ones. And we highlight it. We over communicate and make it as simple as possible so that we don't, so that you know what's going on. You know if they're not eligible, you know if we didn't find them, you know if they're coming in for a prophy and they're not eligible. But yet we also will let you know they're coming in and they're eligible for a panel based on the frequency that's with that insurance company. And instead of just giving you a date, having you do the mental gymnastics, the mathematics behind it, we let you know it's due right now. And same, it's just another example of where we've gone through, we've identified. So if we have deductibles in here, we have copays, if there's benefits remaining, in this case, this one's under $100 in benefits, so we want to make sure that you know that. We don't find people not eligible. We try to make it really super easy, super simple in communicating this information. So not only can we put it back into your system in some cases, we also want to communicate this either through a file that's downloaded and put on your system, or a file that's emailed out to your front desk staff so they know exactly what to do when they get in every morning. And that kind of ends it for our verification side. And we just wanted to take a time. Any questions on this?
Yeah, Patrick, we have a question here, and I think this is probably a situation a lot of people are running into. This attendee mentioned that, there's so much volatility, right? As they reopened, patients' work has changed. They said the majority, 75%, have had a change in insurance. And so just kind of as experts, what are some top line things that a practice should take into consideration as when they're looking at this eligibility piece?
Well, one of the challenges that's there is it's an ever-changing component. It's always fluid, because today you may do verification and you may verify that somebody's eligible, and they're coming in 3 days and the insurance has changed. So one of the toughest parts is you want to do it far enough ahead of time so it becomes meaningful and you can actually act on it. But on the other side, you have to redo it just to make sure you're up to date and that you've got the information that you need to know. So you do find that there's a lot of changeover of that. And with the changeover, it's not just a changeover that you've lost insurance, but you've also transitioned or moved over to another one. So as quickly as you can find out, you can make the call to your patient and find out, was there a change of insurance? Was there anything that they need to know? Because what you want to know is you want to try to take care of that before the patient even gets there, so that when they come in, as you're explaining this is not going to be a big bad patient experience for them. You're actually telling them ahead of time rather than when they get there. So you try to go through the process and ease it, not only for the people that are getting there, but also for your staff, because the staff, they're not having to work with that if they've already taken care of that issue on the phone and they've scheduled them for another time until they can get it worked up. That actually opens up the door to actually treat another patient or get another one in, because what we're finding is that the patients they're needing to come in and they're running out of slots because they're treating fewer patients with more staff, and there's more leeway for all the cleaning that needs to go on, all the sterilization. And so every chair is a commodity. Every time a patient is in there, it's a commodity. So if that chair can't be filled with somebody that is qualified, then you've lost it. Once it's gone for an hour, or it's empty for an hour, it's not going to come back. So
yeah, thank you for speaking to that. I can tell the passion. You guys have about 10 minutes.
Okay.
So keep going. I don't want to take you off task.
Okay, well, I appreciate that. So
I think we're going to pivot into more of the IRAD, which is the remittance advice download process. So really talking specifically around EOBs and being able to pull those down. So in most organizations, and our clients as well have said that they spend 40% of their time in the gathering of information around their remittance advice and payment posting, just collecting the data. And today we're going to center in on that 40% and show you our solution called IRAD, which is enabling organizations to drastically cut that 40% and remove some of the time they have to spend getting into these insurance portals, identifying information, remittance files, deduplicating those files and downloading them. Patrick, if you can advance. So IRAD, we really automate that login process, the actual identification of the remittances. So your staff doesn't have to log in to identify reports and download those. And even if you're using an outsourced service to post remittance advices, what we do with IRAD is actually complementary to that. So we remove the barrier of your staff having to log into an insurance portal, remember an ID, remember a password, identify a remittance, and then download that. We speed up the payment posting process because we enable your staff to focus on posting. They don't have to focus on trying to download and find remittance files or EOBs. And all of this information is stored locally. So it's very easy to get access to, and we put it into a secure environment. and it resides on your desktops with your staff, and it's very easy to access. Patrick, if you could advance. And just to show this process, you know, most insurance portals, your team has to actually go out, log into those portals and actually identify the remittance advice that they want to pull down. They then have to go through the process of downloading that. And then they have to actually start sorting through that and move it to a file folder on their actual computer, their desktop computer. And we take that whole entire process and automate that. So we deliver these remittance EOB files directly to your staff. And when there are no duplicates, we remove those. It's only the current day remittance. When this staff is through posting these remittance files, they're done. All they have to do is move it into a completed file, and the next day they have new remits sitting there waiting to be posted. So again, this is complementary to outsourced services, or if you're doing this manually, it can reduce the time you spend on this considerably. Now we're going to move into Login Credential Management. This is a solution I think you'll like. If you think in terms of credential management and the challenges you face, there is not a single clinic that we've talked to that has not said this is a big headache. And they try to use solutions to solve this problem, but they've had a lot of issues doing it. And out of our own needs to manage IDs and passwords for our clients and the solutions that we've just shown you, we've developed these products to help handle this. But it's a very frustrating occurrence where insurance passwords and IDs are forgotten, they're locked out. It's just a multitude of things. And from a HIPAA perspective, keeping that information in a spreadsheet and running the risk at multiple locations of that data being put on a sticky note or written down somewhere and made available to anyone is a big HIPAA violation and a security risk. And I'm going to pass this off to Patrick now to actually show you a live demonstration of our iCred and our iClick solution and how simple and easy this is to do. So, Patrick.
Hey, Shannon, Patrick, we do have a question about, does this work for plans in New York City?
I don't see, we've not run into any situation where we have not been able to download files. So
yeah, this works with TPO insurance, Medicaid insurance, a multitude of insurances. So unless there's something specific that they're asking, it should work just fine. We'd be happy to circle back around with them. And
yeah, I'll send the participant your email address.
Okay.
And then also after we're done, I'll send you their information as well. Okay.
Fantastic.
That'd be great. Thank you, Jim.
So what we have here is our iClick. And I thought a lot about just giving you a demonstration, taking a bunch of pictures. But at the end of the day, I thought it might just be best to just give a demonstration where we have our system. You have a setup of groups, locations, insurances, and with the click of a button, let me try this. That figures we have this. So once you come in, every user would have their own individual login that would assign specific locations, all locations, specific insurances, all insurances. But it allows you to just, with a simple click, open the file up, click it, and it comes over, goes in, navigates to the web page. As soon as it gets here, allows it to log in. Wow, we must be really speedy on this.
This is a challenge of coming from another software company, why I typically don't do demonstrations on Zoom webinars.
Yeah, well, this is one of those that looks like our internet's just been bogged down with probably a couple of computers and everything else that's running here.
Yeah.
But it takes your information, automatically logs you in, and leaves you there. Now, these worked a whole lot faster earlier, but at the end of the day, we do these for the insurances. So what you're having go on is just the fact that you have a centralized place to keep up with your passwords, with your credentials. The fact that when people are using this, they never look and see a password, they never look and see a user ID. They have everything they need just in the one screen of iClick. They log in, they're able to click what they need. They never need anything else. It gets them in, gets them out, leaves them right where they want to go. And that's it. That's a pretty simple solution. You're not having to worry about anything else. Our solution has a backend called iCred. iCred is basically that centralized web-based management of all your insurance portal logins. What it does is also, with this, it minimizes the time that you have to go with lockouts. It reduces the need to always reset these passwords. And in each case, it allows you to actually create or remove users and assign locations and insurances to those users. Now, I'll show you this real quick. And it's this. This is the web-based portal. So if we're looking at the web-based portal, you're able to come in there, you're able to add insurances that you want to use.
Patrick, can you make this a little bigger?
Yes, I can. You're able to establish locations and then establish what insurances you want to go with those. And then you're able to also establish users. As you begin to look at users, you can see, I want to assign a user to this person called Nick Fury or this person called Bruce Banner. And if I wanted to take them out and not allow them to have access to those locations, I take them out just like that. Or if Bruce comes along and he leaves the company, I can deactivate his access with the click of a button. And now Bruce can't log in and cannot use these credentials or iClick to get into it. This is an administrative portal and not something that the normal users would see. And there's a credentials area. This is where you would keep track of the credentials. So as you come in, you would establish a new credential for a location or for a person. Keep track of it here. Everything's maintained here. Once it's done, and then you're back to working with everything else. You're not having to worry about that. Your passwords are kept private and invisible, so nobody sees the password that's there. It's fully administratively controlled, and it's easy to access. So,
and it's far more secure than what a lot of organizations are having to do currently.
Right. So that's it for the credentials part, for the iClick. And we just want to talk just a brief second about rosters. Within states that have assigned patients to their clinic, we are able to grab those lists, capture those from the portals, and actually go out and pull in their last dates of service. From there, we can actually identify those patients that are not ever treated, that have never been treated by you, they've been assigned, but they're untreated patients. And so once we do that, we identify those patients. The practices can then call and bring those patients in. We also can identify when there's care gaps involved with this, even for existing patients, based on the information that the insurance company shows, and that is when they were last treated or when you last when they last received a bill for those services, like a prophy. So all of this really breaks down to be really simple. We give you a list of people, you go call them, and that's it. They're your patients, they're assigned to you, might as well make the best of them. And so with that, I think that we're done. If there's any questions, I'd love to answer them. Otherwise, I would like to introduce Jordan Stern.
Jim, I think, Jim, I believe you're on mute.
I'm sorry, I was on mute. So there's a question from a participant about, are you able to verify Medicaid through a state site?
We have not found one that we could not verify Medicaid through a state site. Our company, when we created this, it was to really serve those that serve the underserved. It's a big mouthful, but those that treat the underserved patients, those Medicaid, we want to help those out because those are the ones that are usually underpaid, overworked, and understaffed. And so we want to really take that burden off of them. While we can't maybe take all the burden, maybe we can help give them, a little bit of margin back.
And I would tell this individual has a follow-up question here. Please take a screenshot of the email address here and phone numbers for Patrick and Shannon and email them directly, if that's okay.
Yeah, that'd be great.
All right, Patrick, go for it. Make the introduction to Jordan. It's all you.
Fantastic. Jordan, thank you. I want to turn it over to you and appreciate everybody for their time. Thanks.
Thank you so much.
I am off mute. Can everybody hear me? I'm sure you can.
Yeah, you just need to put your presentation into slideshow.
Perfect. It'll get there. So introductory, thank you so much, Lynn Campbell. Thank you so much, Jim, for letting me speak on this once again. I love working with Lynn. I love working with Jim. I can definitely vouch for both. Been working with Lynn for a little while now, and what I'm going to be covering here today, if my screen decides to start up here, here we go. We're going to be talking about virtual HR support and management. Now, these are very deep and wide topics, so I'm going to try and cover them as granular as possible. You're going to have questions. There's going to be items I cover. Ask your questions, but I'll let you know one thing. Answers for typical HR questions are short and sweet. However, they grow and grow and grow because they never just go away. They're only going to get bigger and wider. So what I'm here to show you are a couple items that I really think are really important, especially in this COVID atmosphere and then coming out of COVID. So interviewing virtually is a necessity now. We don't do nearly as much on-site or in-person. So we're going to go over some tips and some items that really make you stand out, but also you can help your interviewee utilize as well. Then there's the big white elephant in the room, which is onboarding. That's what I call the introduction of a new employee to your company, how we can make it a bit more evolved than what you might have today. And of course, the evolution of training in pre, current, and post-COVID. We're also going to go over some new HR guidelines. There's a ton of HR guidelines. I'm not going to scare you with some of the new ones, but we're going to cover some of the bigger topics and some of the broader topics. Then we're going to discuss some streamlining of workflows, because being a multi-office organization, being a single office organization, if you're in dental, if you're in medical, the workflows that some of you have to deal with are astronomical. And to really piggyback on top of Lynn like I normally do, standard operating procedures hold over high. We're going to talk about how these workflows play in tow with the standard operating procedures. And then to follow up with some fun at the very end, we'll go over some easy do's and don'ts, some items I've seen my clients utilize that have worked really well, and some very questionable ones that I know really haven't worked that well, because I like to give you a little bit of the spice. All right, perfect. So the first one we're going to start off with today is just being virtually foolproof. The biggest issue I come across when I work with clients that are virtually interviewing is they're just not as organized as they could be. So a couple line items here, making sure that when you're conducting this interview, you have an objective for the interview. You're not just trying to hire somebody or do it. Let the interviewee know what's going on, how you can be organized within the conversation topic. It creates a much smoother flow because you're not right in front of the person. So it's a little more difficult to read facial cues and stuff like that. Zoom is great for that, but just make sure that you're really honed in on the interviewee. Here's a big one, making sure you have good internet connection and that the app that you're using, whether it's Zoom, GoToMeeting, JoinMe, Fuse, is working or updated. That is usually one of the bigger ones that comes about. You're 10 minutes late to an interview because you have an update on your Zoom. I personally have experienced it. It's no fun. We're all very understanding, but those are just easy things you can let an interviewee know and yourself interviewing take care of. Most of us that are doing Zoom, whether we've got a nice shirt on top, pajamas on bottom, doesn't matter. But just make sure you're letting the interviewee know what the expectations are. And typically yourself, you don't want to look like you just walked out of bed either. Here's one of the biggest ones that Lynn and I talk about when it comes to interviewing. So when we're interviewing for a specific job, people are all different, personality-wise, all the above, and all jobs are different. However, you're trying to find someone that can fulfill a specific standard operating procedure, but at the same time fit into the brand or the type of ethos of that company. These are the areas that a lot of companies might get it wrong to start with, and it costs you down the line. And this is why I love getting to know your interviewee with specific questions offline. If you want to go over kind of what I utilize, because I do a lot of hiring at my firm, especially. We've actually grown operationally during COVID. We're the opposite. We're not losing headcount. We're actually increasing. I've added about 23 operational staff since the beginning of COVID. And that's just because in our product sector, we're actually seeing the exact same thing. People are wanting better, bigger, and just fluid concepts with HR. So when it comes to interviewing, these are some easy focus points. It's very logical, but you'd be surprised how often you kind of forget about it when you fall head over heels in love with a prospect before even meeting with them. So any questions on this area so far? Any hands raised, anything, Jim? All good? Okay, moving on.
I was on mute. You're all good. Yep.
Perfect. So onboarding is a bugaboo. And I know most of you either have issues, problems, or maybe you don't even know you have them until you realize it's too late. A lot of the people on this call and webinar are my clients or have been my clients in the past. So they know our solution, it really knocks it out of the park with onboarding. But whatever you're using today, there's a couple big features you need to make sure you're keeping track of. Compliance. All the craziness with COVID, there's new compliance measures, there's new items you should be adding to your handbook, and you should be adding to your handbook every quarter. If you're not, you need to get on that because those are big bugaboos and it's a cover your butt situation. But making sure your compliances are in order so that when someone's onboarded, they are fulfilling all the requirements they need to start in your place of work. Standardized trainings, depending on their title, depending on what they're doing, you should have a listing of trainings while they're going through onboarding that they know they need to either complete before starting or that they're going to have as they are employed. Huge, huge things that you can set your new staff members up for success. Having a repository or an HR system. This is where a lot of companies, they don't want to invest because they think it's not something that's revenue contributing, when the truth is, this is risk mitigation 101. If you don't have an HR system, if you don't have a repository for all of these features, whether you're onboarding or offboarding, you find yourself being in a lot of trouble. Offline, I'd love to talk to anybody about what's out there and how it works, but make sure your HR system is working for you, not against you. An Excel doc and a Word doc and a filing system is not an HR system or repository in 2020. We can talk about that all day long. Workflows, standard operating procedures. When you have a new employee, the best thing in the world is when a new employee gets sent an email introducing them to a company. They fill out all their new hire paperwork in one fell swoop. They can do all of that either online or it's just one single source of truth for everything. That shows your new employee you guys have things tightened up, but more importantly, they have really good solutions that are going to help them as an employee be the best that they can be. That's what onboarding and training is all about, having systems that work with the employees. Now, onboarding and offboarding automations, this is easy stuff. If you've got a payroll solution, this should be doing it for you. If it doesn't do it for you, call me because we need to have a really fast conversation. Lynn would tell you that too. But onboarding, get everything right. Offboarding, make sure everything's cut off. It's simple, but a lot of systems don't do it for you. So taking away the manual side of the fence is the goal. Pre-hire to retire. I could lecture everybody on benefits, but here's the truth. When it comes to onboarding, that's when your employees should be choosing their benefits, and then they have their 30 or 60-day waiting period. The system you're using should automate that so that your employee and your administrative staff aren't the ones running around like chickens with their heads cut off. If you notice, this is a circular pattern. Onboarding is an evolving feature. Training, those are evolving features. Pre-COVID, you could be pretty all over the place and still get work done. COVID, post-COVID, you got to have things lined up. That's where Lynn's process with being very operationally efficient really comes into play. And that's where having a solution that can guide you, but more importantly, house all of this for you and grow organically, that's where you kind of have the best of all the worlds you could have. So that's onboarding and training. We could talk about that for days, but we're moving on. Here's the fun stuff. HR guidelines. So some current and post-COVID guidelines. There's new compliance measures enacted nearly every week. There's the Quad 6, 70-30, which is the PP 70-10. We could go in this all day long, but the FFCRA, which is the Family First Coronavirus Relief Act, there are guidelines in there that most companies, they understand, but their systems of operation are not doing them the way they're supposed to be. And what I mean by that is, if I've got employees that have family members that have come into contact and they need to take sick time, do you have a system that's calculating that time in attendance and that PTO or sick pay? Probably not. Do you have that for if I've got employee who has a child under the age of 18, needs to be home, sick pay, chances are you don't have something that's automating those features. These are big bugaboos that can really hinder end of year reporting, but more importantly, quarter by quarter reporting. Systems in place like that, offline, we can talk all day. If you are the individual at your company that gets the luckiness to handle I-9s and W-4s, I can see your heads going like this already. The new W-4 paperwork is silly. That's just what it is. It's silly. And if you don't have a system that is technologically proficient, the W-4 is more than likely not going to be correct, just because it's just a breadth of craziness. A lot of calculations. Does your spouse work? Do they make this much money? It's a lot of stuff. Automating that procedure is the goal. But if you don't have something to automate, let's talk. We can find solutions. Handbooks and the EEOC coverage. Lynn knows me too well. Jim, you've heard this from me before. If your handbook is anywhere between 6 months or older from being reviewed and or updated, you're really just tempting the fates, especially current and post-COVID. Your handbook should always be updated every quarter with all the new silliness that's coming with, whether it's ADA coverage, EEOC coverage, FFCRA, PPP. You'd be surprised how much you'd want to add to it, but that's where having those little needles move are going to be very helpful. If you have any questions about employee handbooks, EEOC coverage, any of that stuff, please let me know. I'm happy to answer. And then especially now, hiring and firing guidelines. Hiring employees is very fun. It's very, very fun. But there's a lot you need to keep track of, and that's where having the onboarding system we talked about a minute ago really, really streamlines your procedure and keeps you out of trouble. Firing or termination, same thing. Whether you have employees that have assets, benefits, key codes, cards, we could go on for days. If your system keeps up with that, make sure that you're measured, has all that tracked, you're good. If you're doing that all on a spreadsheet, chances are there's a little bleeding of money, but you might be okay. It's all about having this tracked and having it in a self-sustaining system. That's what you're going to hear from me all night. You got to have a system. If you don't have a system, you're tempting the fates. Okay, so those are some HR guidelines.
Hey, Jordan, we do have a question here. So you talked about, a participant's asking about best practices now in the COVID world, kind of handbook, employee handbook. So what are some things that you've seen that you say, wow, this is great. I want to make sure that other people apply these one or two elements to their employee handbook.
Perfect. So especially with COVID, you need to enact everything that's covered in the FFCRA. So that's simple stuff. Like if there's exposure, here are standard operating procedures, bop, 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 bop. Same thing with if I have an employee that's refusing work. There are standard operating procedures you can follow, and they all need to be listed. Just like everything else, exposure, limitations. I myself have had employees that have come into exposure. And guess what? In my handbook, the first thing I did with the employee is I said, please go to page 16, line B. We have everything covered. I'm going to send you an email covering all the guidelines. Then I communicate to all the other staff members they work with in accordance, and you just follow those standard operating procedures. So when it comes to an employee handbook, go to your FFCRA guidelines. There's a tremendous amount of information online. Make sure it's not just a Google source. Make sure it's from reputable sources. SHRM is great. HR360 is fundamentally the best in the industry. I personally have HR360 built into my system. Nice little plug. But basically, you want to make sure your handbook has those bullet points that are covered with everything related to FFCRA. And then as the world turns, your county, your state, and of course the federal government. I hope that answered your question.
Yeah, great. Thank you. And again, if you have more questions for Jordan, he'll put up his contact information here in a few minutes.
Thank you, Jim. All right, moving on from HR guidelines, improving HR workflows. Now, workflow is the great term. It's like gluten. People know what it is if you look it up, but it's a gluten. That's a joke. But workflows are basically items that we take from being tasks to basically automating activity. So that's a workflow. So today, if I'm going to PTO, I ask Joe, Joe approves it, it goes into a calendar, no one else touches it, the accruals and everything move. That's a workflow. So unfortunately, in the HR space, there are a tremendous amount of workflows. Some of them work against you. Some of them should work for you. One I'm going to talk about is calculating sick pay, because if you have employees taking sick pay, whether it's COVID or regular, depending on your county, your state, the federal examination, there's the 100% rule, there's the 2/3 rule. If you don't know what you're doing, get with a professional, because I'll be the first one to tell you Googling it is actually the wrong thing to do, because Google has a lot of bad information as it relates to calculating sick pay. A lot of my clients have found that out the hard way. Managing HR data. This is a big, big task. I have employees all day that give me data points, whether it's time and attendance, whether it's asset management, whether it's their benefits, whether it's PTO. If you have a system that's coordinating all this, reporting all of it for you, or is a click of a button away, you're set. You're probably happier than a pig dipped in you know what. If you don't have that, these times currently are what's probably causing you to pull your hair out. Good thing I don't have to worry about that right now. But managing your HR data is the exact same as running your payroll. Do you want to pay people correctly? Of course. Do people want to be paid correctly? 100%. The data. If the data is not correct, your system is basically broken. And those who are my clients that are on this, you're laughing because I give the exact same spiel to everybody. The HR data is very, very much matriculated in the system and out of the system. Make sure that happens. PTO, sick hours, hours worked. I could go on for days. Here's the simple truth. If you've got technology that takes care of it, wonderful. If you don't, probably need to change that. And in the dental sphere, what I come across more than anything, especially current COVID, a lot of dental professionals have probably 7 different technologies. They've got a project management, dental management, 11 different things. They all hit specific buttons, but the one overlap I always find is the dental management software basically trying to do the same job as a payroll software. And that's where I get to have a lot of great conversations, because the dental management software is not built for that. And I get to come in and educate why the two should be separated and how that actually equivalates to better workflows. Managing your HR data, time, payroll. If you've got multiple offices and you do not have a workflow for time and attendance, and what I mean by that is if you've got 10 locations, each location is individual, and you've got people moving in between, number one, I know how much fun it is with those pay stubs and W-2s. That can be changed very quickly in a lot of efficiency and legality, but multi-office, having time and attendance and payroll touch points, streamlining, creating paymasters. This is what enables your administrative staff and your employees to not only be more reliant on the data, but for the data to actually be more seamless and to actually be more transparent. Multi-location equals headache. Multi-location with singularity equals easier to manage. I can talk through 5 different versions of that. If I'm speaking a different language on that, please let me know. But I'm an expert as it relates to taking multi-office companies and just reducing the craziness of the workflow they have and making it much more streamlined. Okay? So we're going to finish with 2 really fun buttons, do's and don'ts. In COVID, there's a lot of issue we found with the don't column. When I say ignore, what I say is if your employees are talking about a specific topic or you hear about specific topics often, which is the big case, because there's a lot of feelings towards COVID and working and all that, don't ignore the voice of the employee. Don't procrastinate on setting a meeting to talk about the employee, and don't disregard what's going on. Responding emotionally is a big time don't. Because what we find is if you respond emotionally to something in the moment, that's usually where you get the beautiful letter in the mail that says they're going to take you to task and maybe even try and bleed your finances a bit. Opposing personal values or beliefs. Doesn't matter what you think. You're running a business, you're an administrator. It's all about ensuring that you're giving your employees a safe, responsible place of work. And if you can inspire them to basically understand your motivations, a lot of these problems kind of fizzle. But if you're experiencing this, it's all about communication. It's all about alignment. But more importantly, the standard operating procedure to deal with all of the don'ts, align the beliefs of the company with the beliefs of the employees. Because if they believe in the vision, there's not a whole lot to deal with that's going to be counter to that. So the don'ts they're a fun one to cover because the do's are really logical. All right, so some do's. When dealing with anything related to employee engagement, when dealing with anything to deal with HR, all of these, they're kind of no-brainers, but you'd be surprised. We all have day jobs, we forget. These are some things, I'd put a sticky note on your desk. Always remember. Timely answering of questions. Employees leave companies. Employees don't leave companies, sorry. Employees leave their management style or the fact that they're not heard. So when they ask questions or need answers, be timely, be direct, be open. Make sure your employees know that they can engage with you. Make sure that you're actively listening, meaning you're asking them questions as they're asking you questions on how to facilitate betterment. And then resolutions, those are easy. If you can find resolutions to problems, employees are happy. Here's where most everyone really messes up. Documenting and following up. If you have an HR management system, you should be documenting everything employees ask you and everything you say back to them. And you should also make sure to follow up with them in timely manners to make sure you're inspecting what you expect as an outcome. There's a lot of fun in managing the HR spectrum, but there's also a lot of craziness, especially now. But remember, you've got people like Lynn, you've got people like myself, you've got people like Patrick, Shannon, Jim. We're all industry experts. I just happen to work in the craziest field imaginable, which is HR and payroll management, because simply put, you've all probably dealt with payroll or HR companies. There's a reason you either moved on from one or you love the one you're with. Remember, change is a good thing if you're doing it for the right reasons and you're getting a better outcome. So I'm really excited to have presented this to you today. If you have any other questions, I'd love to answer them for you.
Yeah, George, do you have a slide with your, or maybe you can just put it into the Q&A field or the chat feature with your contact information?
Not a problem whatsoever.
Okay.
I'll put that in the chat feature.
I'm gonna go and grab, yeah, thank you. Very robust discussion here. And I'm gonna bring us home here and then back to Lynn in a few moments. Thank you all for being super engaged. I think where I wanna start out with the CareStack discussion here is just make it relevant to the topic that we're discussing today, which is disrupting dental management. And so the two things I wanna speak about are what we all know, that patients and staff alike are coming back to the practice, and whether they're telling you or not, there's a level of discomfort. And how do we know this at CareStack? Because we're fortunate enough now to be in close to 800 practices, and we're bringing on the 7th largest DSO in the country as we speak. So we have a really good pool of information. And so what we hear from the staff is, they want to be put at ease. They don't want to be touching things unnecessarily. But at the same time, they're still held accountable to things like over-the-counter collections. So I'll give you an example. We had a group come to us and say, our patients don't want to use the credit card terminal when they leave the practice. And we don't feel comfortable pushing them an invoice because we know that we're going to have to chase that AR for 30 to 45 days. And whether it's $20 or $100, that just becomes an AR nightmare. And everyone on this panel and attendance can speak to that. So what CareStack has evolved into an offering is the ability to pay by text. And so that patient receives a text message, and I'll do this the old-fashioned way and try to hold this up on the screen so you guys can see this. They're going to get a text message on their phone, and tell me, guys, if you can see this okay. And it's going to bring up a statement in a HIPAA-compliant portal and no, you can't see it? Is that any better?
No, it's not on your screen.
It's on my camera, right? And so the beauty of this is that they don't have to download a password. They don't have to create another patient portal to pay something. It allows you to maximize your collections, keeps your staff whole, and that really helps to put the staff at ease because they want to do their job. They're graded and reviewed on things like over-the-counter collections, especially if they're in an operational role. It's part of the standard operating procedures, right, Lynn, to have hey, this is how we handle payments. And, you know, fact of the matter is every other profession is charging at the time of service in COVID. Why should dentistry be any different? Why should the patient expect to go home and pay 45 days later? And so that's what we're doing. You know, that's one way that CareStack's evolved. So our clients have told us, they've challenged us during COVID, you've got to make this technology better. And so we've launched pay by text. That helps the offices run at a higher operational level. The other piece I really want to talk about is using the car as a waiting room. And I know Jordan and Lynn spoke about this and how this can, you know, change, you know, the clinical flow. But patients, you know, they don't want to come into your waiting room. No matter if you have chairs 6 feet apart or not, maybe they're not telling this to you, but we're getting enough phone calls about it. And people are saying, how can I enable technology to take away the pressure of, you know, people not wanting to wait in the waiting room? They just don't want to do it. They're not going back to movie theaters. Why would they want to sit in an area where there's aerosols that are being, you know, put into the environment, right? Just, if they're not telling it to you, they're saying it nicely. And so one of the ways that CareStack has evolved to support the needs of our emerging groups, and just to show you, I'm going to go to my technology. I tested the internet. Hopefully you guys can see this okay. You know, we've enabled curbside check-in within CareStack, parking lot check-in, whatever you want to call it. And what's different is, for if you're out there and you're using like some old legacy system that you've got a huge stack of computers, you have to bolt this on with one more thing. And this is native within the product. So the EHR automatically knows when your patient's coming in for, let's say, their 10 o'clock appointment. So you could set the trigger, 15 minutes, 10 minutes, an hour before the appointment. They're going to receive a customized text message the way that you brand it, however you want to use your lingo, right? So Lynn, if you want to throw a y'all in there, go for it, because you're in Texas. Maybe if you're in New York City, you want to say forget about it. If you're in Brooklyn, whatever it might be, you can customize this message. It's not canned by CareStack. And then when the patient receives this, when they're in the parking lot, they text C to confirm, and now it changes in the EHR, lets them know that they're in the chair, that they've arrived, excuse me, alerts the staff, and then pushes out the next message that you want in the cadence. So here's the benefit. We had a 10 location group come to us in South Florida and say, thank God you've done this, because we have 7 operatories and we get about 21 phone calls per appointment saying, I'm here, I'm in your waiting room. And these are South Floridians, so maybe they're really high touch and they're divas, but that's really frustrating and challenging to this group. And so now we've eliminated the need to have that 21 phone calls for a 7 operatory practice. So if you go to YouTube and you search curbside check-in with CareStack, you'll see a testimonial video from this practice where they actually interview their patients and have the release forms from them where they talk about how it's impacted both the practice and how the patients love it. So I just kind of wanted to end with this. There's a lot of things I can talk about with CareStack. I think for everyone who's not familiar to this, you've heard this before, but we're 100% cloud-based solution for the complete management of the dental practice. And our value proposition is that everything is included in one. So you don't need to have all these solutions stacked up on the right-hand side, bolted on to, you know, your Frankenstein computer closet that you're maintaining that huge IT risk. This is all done through a Google Chrome browser. And as time has evolved during COVID, we've added this functionality to support the needs of groups. All this can be run in a centralized environment. So that's kind of my spiel here. We do have a couple questions, Lynn. Oh, great. This is Jordan's contact information. And Jordan, yeah, the attendees can see it. Great. Thank you for putting it up there. And so, Lynn, I want to bring it back to you to bring it home. But again, if you want any more information about any of these companies, the logical thing to do is, if you didn't take a screenshot of the contact information, is to reply back to probably one of the 10 emails you received from me and say, hey, Jim, I want to speak to Shannon. I'd like to talk to Lynn or Jordan, and I'll make sure that I forward that email to them. But I want to thank everyone for participating tonight. And Lynn, I'll turn it over to you to kind of close this up. That's all right.
Jim, thank you. And Jordan, Shannon, and Patrick, all of you, thank you very much for your participation this evening with this audience. And more importantly, as a participant joining us this evening, I hope we were able to deliver to you some information, some, if you would, some tools for success, keeping in mind as we walk away, it's some standard operating procedures. So it's, if we can just stay structured and be disciplined in our structure, it'll help us get to where we need to be, and that's to be more successful. I will share that the way that we put these webinars together is really the voice of our clients. And it's very important because it's like you on this call tonight, you're sharing with us what's frustrating with you or where your pain points are. And we do take that information and we build out our next webinar. And I will lead that to you. Our next webinar will be on Thursday, September 24th. It is an evening webinar. It's actually going to be one of our main hosts on that webinar will be Oberman Law Firm. We're getting a lot of inquiry about, again, PPP and EIDL, and we're getting a lot of HR. There's COVID's definitely given us a lot of guidance and direction. And Oberman Law Firm, many of you may know, supports us in the legality of building emerging DSOs, all that legal language that needs to be used, legal documentation for bringing on associate dentists, as well as HR and all the legal there. So we do have a big piece of legal. There'll be others as well, because we're definitely listening and hearing what you're saying. And we just, again, want to bring to you resources. If we can be value to you, that's great. But if we can just guide you so you're more successful, then we've done our job. So with that, thank you everyone for your time this evening. We greatly appreciate it.
Thank you. I'll just mention the best place to find out about these programs is to follow Black Ops Management Solutions or CareStack on LinkedIn. That's where the information will be. So thanks everyone. Appreciate that.
Appreciate it. Have a great
Thank you.
day, everyone.
It was a pleasure.
Evening.
Really enjoyed it.